everyone, it's Jasmine from the Moorpark College Health Center, and it's time to get vaccinated. Let's talk about the Janssen or Johnson & Johnson, aka J&J vaccine. So adenovirus technology, which the J&J vaccine uses, has been around for decades. And here's what we know so far about this vaccine. It's 66% effective against symptomatic COVID-19 and 85% effective against severe illness, and it's nearly 100% effective against death. It only requires one shot, and someone is considered fully vaccinated just 2 weeks after they received their one-shot vaccine. It was developed by the USA and Belgium and was approved for use in the US in February of 2021. The vaccine works by using an adenovirus, which is like a common cold virus but cannot replicate, to deliver a gene for the COVID spiked protein. Your body cell then engulfs this adenovirus, and the gene for the coronavirus spike protein is read by the cell and copied into a molecule called mRNA. The cell then begins to assemble spiked proteins, and eventually spiked protein fragments are taken up by the immune system to make antibodies. These antibodies can latch onto coronavirus spikes, mark the virus for destruction, and prevent infection by blocking the spikes from attacking other cells. The J&J vaccine cannot replicate or change anyone's genetic code. It has also been proven effective against various variants. Nearly 44,000 people in South Africa, certain countries like South America, Mexico, and the US took part in the J&J clinical testing. There's been some media attention around blood clots in the J&J vaccine, and there's been some concern because the CDC put a temporary pause a while back and then resumed vaccinations with the J&J vaccine. But according to the CDC, the risk of a blood clot from this vaccine for women aged 18 to 49 is 0.0007%. And it's even rarer for women over 50 and men. To put it in other terms, an NCAA football player is 10,000 times more likely to make it to the NFL than to develop a blood clot from this vaccine. Furthermore, a study done by Yale and Mass Gen looked at clotting factors in ICU COVID-19 patients, and they found that many of the sick COVID patients had extremely altered factor V levels, which is responsible for clotting. Of those with altered factor V levels, 33% experienced a clot. So COVID-19 itself has been associated with clots. And some common side effects from the vaccine include pain at the injection site, headache, tiredness, and or nausea. Less than 10% of people in clinical trials reported a cough, fever, joint pain, chills, and or swelling at the injection site. Less than 1% reported sneezing, tremors, throat pain, rash, muscle weakness, and pain in the arms, legs, and or back. And less than 0.01% had an itchy rash. So these side effects tend to be short-lived and temporary, but for more information, visit the CDC's website and stay tuned for another dose.